You're watching the Fox 5 Morning News at 7.
Live look from our SDCCU.com camera. Good morning to you. Sunshine 742 on this Tuesday. Thank you for spending part of your morning with us. It is always good to be here with you. All right, if you are self-isolating with a spouse or partner, your health relies on their health. Dr. Richard Chaffoo has more on what you need to watch out for. Dr. Chaffoo, good morning. Good to see you.
Good morning, Shally. Good to see you.
Let's talk about this, because I know that there's a lot of people in the past few days and weeks who have been exposed in some way or another to COVID, and then you're supposed to self-isolate, but you're at home now with family. So how important is it for you to be able to pick up and know what the symptoms are, and quickly?
So, Shally, it is important because, scientists and epidemiologists have explained to us that, once you actually get the virus, you've been exposed to it, and you're positive, you can actually, from 2 days to 2 weeks, you can spread this virus. So certainly that self-isolation period for that first 2 weeks is important. But besides that, you want to have quite a lot of self-awareness of some of these symptoms that may indicate that you have the virus instead of just the testing, but knowing, when you're potentially exposing your family members or certainly other people.
So I want to go down the list and talk about some of these symptoms. And I look at one of them, and it's very interesting, because my younger brother, who doesn't live here in California, his girlfriend was exposed to COVID, and they both ended up testing positive. So they both got COVID-19. But her first and major symptom was loss of smell. That was it. She just turned to him and said, "I can't smell anymore."
Yeah, and that's a very classic symptom, the loss of smell, the loss of taste. But these are symptoms, as you can see, obviously difficulty breathing or shortness of breath. You can see that in a respiratory illness. If it's short term, then it isolated on its own is probably not going to be a symptom. But if you have shortness of breath that persists, where maybe your lips begin to turn blue, or your fingernail beds begin to turn blue, that's a sign of a more serious respiratory illness. Of course, COVID-19 would be right up there. Shaking chills, you can just get a chill from a draft or something mild. But if you have these shaking chills that are really significant, or say they come in waves, again, that makes you think more likely this might be a symptom of COVID-19. Coughs are another, but a dry, persistent cough, again, makes us think that this could be an early symptom. As you said earlier on, unfortunately, with your brother and girlfriend, the loss of smell or taste can occur in other respiratory viruses, but certainly we've seen this quite classically in COVID-19, again, either as an isolated symptom or related to some of the other symptoms. Chest pressure, fever, these are other symptoms that, again, are common. Associated with respiratory illnesses, especially COVID-19.
I want to talk about the fever, because there was some emphasis on that. There still is in some way. You go to a lot of places and they're constantly checking your temperature. But on the other hand, I know quite a few people who did get COVID-19 and they didn't have a fever, not for a day, not for a second.
Yeah, and that's important, I think, for everybody to understand, is that, an individual isolated symptom is in and of itself not necessarily going to indicate that you do have COVID-19 or that you do not. And as you said, people that have fever, that's certainly a symptom, but 40% of people that test positive for this virus do not have a fever. And what do we mean by fever? We typically say in medicine you have to have a temperature of 100.4 degrees or higher that's persistent in order for you to really have a fever. So it's not something, quote, low grade like 99 or 100. It really needs to be 100.4 and more so. And I think the important thing also, Shally, is, when we take our temperature, to remember, you don't want to drink something warm or drink something cold and then immediately take your temperature, because it's either going to be abnormally elevated or abnormally low. You want to wait about 30 minutes and then take your temperature at that point.
How often should you take it?
use.
Because I know when the kids, or if anybody gets anything, we start getting a little cuckoo and just constantly we're like, come here. And then 10 seconds later,
Let's
okay,
check your
what is it
temperature.
now?
Yeah, you feel warm or you feel flush. Yeah, you need a thermometer. I mean, we all have periods where we feel warm, we feel flush. It's a temporary phenomenon. It's not a very accurate sign, or I feel like I've got a temperature. So you want to really make sure you have a good digital thermometer that works, and you want to check your temperature. But again, if you don't have any other symptoms, and if your temperature, let's say, is normal, it's not something that you need to get too anxious about. It's not something that you need to check every single day. But again, if you have a persistent elevated temperature, 100.4 degrees or higher, and especially if you have other symptoms, most experts, the CDC, in fact, says go ahead and get tested for COVID-19. So I think that's the important thing, that if you have a slightly elevated temperature, maybe 1 degree or 2 degree, and you don't really have any other symptoms, you may want to monitor your temperature for a few days.
All right, all good advice, Dr. Richard Chaffoo. It's always good to see you. Thank you.
Good to see you, Shally.